Hello, my name is Michael Trader. I'm the co-founder of RightPatient, a cloud-based biometric platform to accurately recognize patients during healthcare encounters. So imagine that you arrive at the emergency department, you're delirious, you have no ID. The nurse creates what's called a John Doe record just to get you into the system so that you can be treated. Well, what if you already had a record in the system? The duplicate record that was created is a missed opportunity for the clinical team to find out what could be very important information about you, like allergies, pre-existing conditions, or existing medications. Unfortunately, this kind of thing happens all the time in healthcare and is a big problem. In fact, one of our customers, Novant Health, a 14-hospital system out of North Carolina, recently wrote an article about this exact situation happening in their emergency department. A woman arrived, couldn't be identified. With RightPatient, they took her picture, instantly identified her, pulled up the correct medical record and all of her information, and were able to contact her husband. This is such a big problem in the market that Chime, which is basically the CIOs of all the major health systems in the US, is awarding $1 million to solve it. We found out last week that we were actually selected as one of 8 finalists in the initial round. I'm very proud of that. So why is this important? It shows that RightPatient is the cloud-based biometric platform that will solve the patient identification challenge in healthcare. When used with what we call photobiometrics, patients simply take their picture, and RightPatient reads unique iris pattern data to accurately identify the patient and pull up the correct medical record. The beauty of this is that by linking the biometric data in the photo to the medical record, once you're enrolled, you can never be linked to the wrong medical record, and you can always be easily and quickly identified to ensure that your clinicians have the access to your health information. This has a huge impact for hospitals. They lose $2 billion annually because of duplicate medical records, and that's just the tip of the iceberg. RightPatient also helps to prevent fraud, improve revenue cycle through proper billing, reduce litigation costs, and also improve data integrity so that hospitals can better understand their patient population. Using our face recognition engine, RightPatient can also be used as a centralized authentication platform to authenticate patients during remote encounters, like logging into a patient portal or during a telehealth session. This is a growing market, and we will be the centralized authentication platform to prevent the risk of data breach. Huge market. Only about 10% of hospitals have adopted this type of technology, but we've seen a growing trend over the past year where they're seeing this as a must-have. This is also a global phenomenon, so there's an enormous market opportunity for RightPatient. It's also a proven solution. We've amassed a very considerable customer base, including customers like Hospital Corporation of America, which is the largest healthcare provider in the world, and we also have many other customers as well that are currently using the product in production. RightPatient started as a product under my former company, and when we spun it off last year, we brought all of the great talent with it. So not only do we have deep experience in biometric technology, system integration, and cloud computing, but we've all worked together for over a decade. So we're focused on selling RightPatient to hospitals and health systems, and currently we're doing that under a SaaS subscription model. Previously it was a traditional enterprise model. So under the SaaS model, customers basically pay a monthly subscription fee for RightPatient where everything is included. This gives us a lot of flexibility and allows us to pursue a land and expand strategy. We did $1.4 million in revenue last year and almost broke even. We'll have 30 customers signed up on RightPatient SaaS by the end of this year, with 750 hospitals signed up by the end of 2020 at an average fee per hospital per month of $4,500. That equates to about $40 million in revenue, plus revenue that will also generate from additional channels. So what are those additional channels? In addition to the RightPatient SaaS revenue, we'll also license access to our authentication engine for remote authentication of patients in some of the areas that I had mentioned earlier. In addition, because we know the patients, we know where they authenticated and when they authenticated, insurance payers like United Healthcare or Medicare will be very eager to pay a transaction-based fee to access this information since they lose billions of dollars each year due to fraud. We've put $2.5 million into RightPatient so far to build the best product in the market, integrations into all major electronic health record systems like Epic, and a very, very, very strong customer base where we're producing revenue. We're seeking $3 million in growth equity, and I feel that we're perfectly positioned to conquer the market and ready to launch this rocket. Thank you very much for your time, and please let me know if you're interested in being part of our success.
So I have a question. It felt like that the primary message you were telling us at the beginning, the value proposition was a scenario in which the patient was unconscious and without identification. And I guess I'm curious how often that actually happens and how much of the business is predicated on that.
Yeah.
I guess it's a two-part question, because then the second part of the business is, okay, so you can use retina scanning to check in, to look at your medical records. What pain are you really solving there? Where's the business value proposition
So
there?
to answer your first question, patient identification is not just specific to identifying an unconscious patient. Patients can be easily misidentified for all sorts of reasons. You could have a patient that comes in with no ID. You could have just simple user error, keystroke error. You could have, a situation where a patient just...
But how often does that really happen? I mean, I guess
Yeah.
lots of things can happen, but is there really a big business opportunity?
It's a
based
huge
on this?
business opportunity. First of all, I don't think that an organization like Chime would necessarily be putting a contest out where they're awarding $1 million and drawing all this attention. They're partnered with the ONC on this initiative. So there's a tremendous challenge that they're trying to fix in the market. In addition, if you look at the amount of money that hospitals lose because of duplicate medical records, because of fraud, the impact on patient safety. If you arrive at the hospital and they can't identify you, they can't pull up your medical history, they can't provide the highest level of care. So hospitals more and more are very focused on improving quality, reducing costs, producing better outcomes. And it all starts with accurately identifying the patient. That's the very, very first step in the healthcare process.
You're making the assumption that the electronic health records system isn't already accounting for a lot of this. Mm-hmm. And is this just become a module to the EHR?
Well, we seamlessly integrate with the EMR. So we build integrations into Cerner, McKesson, Meditech, Siemens, which is a huge accomplishment in and of itself.
Right.
The problem is that, especially when hospitals switch to a new EMR, a lot of times they have new processes that they institute, and it's very easy for them to create duplicate medical records. It's just a phenomenon that is kind of is what it is, but it's a big problem in the marketplace. And when it happens, it causes all kinds of downstream negative consequences affecting revenue cycle, billing, patient outcomes, et cetera.
Let me ask maybe just the more direct form of Paul's question, which is, so why isn't this a feature of EMR as opposed to, why is this a separate company and a separate product? Because the EMR companies are focused on other things. I mean, these are massive platforms that have so many different modules. So, and biometrics is a science. It's not something that you can just pick up overnight and write some simple code and plug it in. We built this company, spun this company off from my other company, which has got 14 years of experience in biometric technology. So we know this stuff inside and out. We've architected a tremendous solution that's highly scalable, very fast identification, extremely accurate. And so this isn't something that the EMR companies necessarily even want to get into on their own. Oh, the chirps didn't go off. Thank you guys very much. Appreciate it.
Thank you. Thanks.